Hi, I'm Alana Heaven-Steele from Pharmacy Times. Before we get started, one of our top articles today discusses how COVID-19 can make blood clotting cells hyperactive, which can cause potentially deadly clots. There's more of that on pharmacytimes.com. Today I'm speaking with Bernal Silva, a patient spokesperson for National Blood Clot Alliance, on a recent survey regarding patients' fears of a life-threatening bleeding event while taking anticoagulant medications. So Caroline, results from the survey showed that 55% of Americans aged 18 years and older who are currently taking anticoagulant medications are concerned about a life-threatening bleeding event, nearly 3/4 of whom said this fear has affected their quality of life. Do these results accurately represent your own experience as a patient who has taken anticoagulant medications for many years?
Absolutely. I think that's the short answer is absolutely. We all have these fears. The long answer, though, is it doesn't have to be. You know,
Right.
I've been on, like you said, anticoagulants for 11 years, so I certainly am talking from a position of privilege because I'm on the other end of
Right.
a long, very painful journey to find the right medicine for me.
Mhm.
But what I think, you know, the survey is totally, absolutely correct, but I just want that to raise awareness. Sorry, Alana, I slipped up a little bit. To raise awareness for the patients to understand that it doesn't have to be like that. And I think some of the other things we'll cover today will kind of illuminate some of
Yeah, absolutely.
these.
Absolutely. How has taking anticoagulant medications affected your life over these years?
It's impacted my life drastically. So just to give you a little background on myself, Alana, I was diagnosed with an antithrombin 3 deficiency when I was 19 years old. I was a college basketball player who just happened to get a pretty wicked elbow to the lung, which started off a perfect storm, which resulted in about 50 blood clots from my waist up, massive PEs, and a collapsed lung. And so that's really when my anticoagulation journey started. And
Okay.
over those 11 years, I've been in the hospital, I think about 8 different times.
Mm.
And each time taught me something incredibly different. But in terms of how it's changed my lifestyle, it really boils down to the relationships you choose. I know the survey talked about brushing your teeth. I sometimes joke that when I floss, it looks like a Scorsese film. It really impacts every little bit of your life, from your relationships to your daily routine to where you live, what hospital you live closest to. And so I certainly think that anticoagulation is a necessity, especially for people like myself, but it does come with its complications.
Right, right, absolutely. Yeah. Um, how has your healthcare team advised you against certain activities? You mentioned certain things that maybe are a little bit more difficult than for the kind of like, regular brush teeth, teeth brushing activities might be a little more complicated. So how have your healthcare team advised you against certain activities
Mhm.
in order to make necessary changes to your lifestyle?
Sure. I mean, like, we could start from when I was 19, again, being a college basketball player. I don't play any contact sports anymore. My friends always invite me to go, take boxing classes and things like that. And I have to say, hey, I bruise like a peach. I can't, I can't show up. But I think in a more real way too, it's changed my lifestyle. And they advised me on where I can and cannot travel to. The
Got it.
hospital systems, my husband and I don't go to remote places to travel if there's a hospital that, you have to be medevac to 2 hours away.
Right.
And so it's a consistent thing that's always on your mind when you take anticoagulants.
Yeah.
And it certainly, I just am thinking about all the conversations I've had with my medical team where I'm like, are you sure I can't do that? And one of the ones that always pops in my head is I work in sustainable agriculture. So I
Okay.
was on my way to Indonesia to work with a team, and I just happened to go to my doctor's, and I was like, oh, this is what I'm doing, because he was asking me what was new in my life. And he said, Caroline, you can't do that. It was just such a funny moment for me. And I was like, oh, wow, I really do have more barriers that I realize sometimes, because you look and you feel wonderful, but it's not always the case on what's going inside your body,
Yeah.
especially when you take anticoagulants.
Right. Right. So, you've talked about a few of your fears and concerns regarding taking anticoagulant medications and how it has affected your life. Are there any others that have kind of appeared and affected how your lifestyle and whatnot?
Sure. I think the thing that always resonates when I talk to people about taking anticoagulations is it really is such a granular thing when it comes to changing your lifestyle and the concerns and fears you have. I'm always happy to let people know. Alana, you'll figure this out over the next 20 or so minutes. You can ask me anything, and I'm always okay with answering it.
Okay.
But when it comes to like those granular things, where I moved apartments because I couldn't take the subway anymore because I had such
Mhm.
anxiety about if I got stuck, would I be able to get to a hospital if something happened?
Yeah.
Where where I live is only 30 minutes away from a medical team that took me 11 years to piece together. And
Yeah.
so I think there's very real things like for fears and concerns. But again, I just want to make sure I'll keep reminding people that are watching that I'm talking from a place of 11 years being on anticoagulations, knowing that I'll also be on it for my whole life.
Yeah.
And so raising awareness on that, it is scary, don't get me wrong, and it does affect your lifestyle significantly. It really doesn't have to. It's redefining who you are and
Mhm.
how you're getting to where you need to be and putting together almost a toolkit of things that will help you move through life. So I talked about going to Indonesia to work in sustainable agriculture.
Yeah.
Guess where I work now? I work at a sustainable ag organization that really focuses that in Indonesia. I just do it from the comfort of New York,
Yeah.
where my medical team is. And so it's just redefining how you get there. So there's definitely a lot of things that impact your life and fears and concerns, but
Mhm.
as you move through your lifelong anticoagulation, it's just redefining who you are and how you want to get to your goals, and life ends up kind of awesome.
Yeah. That's wonderful. That's wonderful. Yeah. Um, so you've kind of talked about in some ways that having these 11 years has been really kind of beneficial for your kind of awareness of your own kind of like healthcare team and whatnot. Have your fears or concerns changed over time, or stayed mostly consistent? Or yeah, how's your own kind of internal dialogue progressed over these years?
Sure. I mean, I think that's it's a little bit more of a complicated question. One, because as you grow and get older, your fears and your concerns change. It
Sure.
also depends on what medicines you're taking as well.
Yeah.
And so when I was first diagnosed, I was very afraid of, I was 19 years old, even walking down the street, I was like, oh, what if my INR level's too high? What if it's too
Right.
low? That was just that basic thing was incredibly scary. Now, as I get older, I talked about traveling, I talked about where I live, but you also get into family structure. Do I feel comfortable having a child and giving birth?
Yeah.
Why, I while on certain anticoagulants, I have an incredible medical team that we come up with our plan of what that will look like. But your fears and your concerns absolutely change as you get older, and as your life changes. And it's always something, Lana, every time you take your pill, I take mine once every morning and night, it reminds you that you have something wrong, that you do have, um, for me, a genetic disorder and an anti-thrombin 3. But it's something that becomes such a part of your life that I don't know. I don't know what I would do with. I mean, you don't know what you're going to do without them, because
Right.
the alternatives, certainly the benefits way outweigh the alternative of them. But throughout your life, it's always a reality that you live with.
Mm. Yeah. Yeah. Um, so have these fears and concerns ever brought you to consider going off the medication for any period of time? And if so, what was your process in considering this prospect?
Heck yes. I was 19. I wanted to play basketball. My friends were on the team with me. My life was totally flipped upside down. And I really wanted to go off of it. I was also really young. My body wasn't breaking down the medicine. So I lost 20 pounds. I started to lose my hair. I mean, it just wasn't a lifestyle that I wanted for myself. And so I went about, finding other doctors and really figuring out what the right process for me was. And I think through it all, I did eventually go off my medicine and then landed right back in the hospital.
Mm.
And that was an important lesson for me to learn at a young age is, as a patient, you have to be your best advocate. No one knows your body like you know your body. And so, again, it always comes down to the medical team you have in place and who you trust, and making sure that you're sharing the right information with everybody, asking the tough questions like, hey, I want to play basketball. Is that a reality? And really having that negotiation with your doctors. I think that's an important piece to it. So
Yeah. What do you hope for the future in regard to anticoagulant medications?
it's a funny question, because over the last 11 years, medical professionals and pharmaceutical companies have had made incredible strides with anticoagulation. I've run the gambit on the ones I have been taking. It's just an incredible, life-changingly great strides over the last 11 years. And so I think the next step is to raise awareness about taking them. So if this survey is reporting what I have experienced, where people do have fear doing basic things, gardening, walking barefoot, I think the next step is for us to start combating and raising awareness of what it means to be on anticoagulation and not have to live in fear. Like I said, you take your medicine once or twice a day and it reminds you that you're sick.
Yeah.
Even though you don't look sick, right?
Yeah.
And you're afraid to go barefoot. That fear is crippling. And so redefining what your life looks like and raising awareness, that's a possibility. And it does, like for me, again, I know I'm talking from a place of privilege because I've been on my medicine for 11 years, but I'm definitely here to say it gets better and life ends up being a lot richer.
Yeah.
Because you've gone through some interesting stuff.
Yeah, absolutely. I can imagine in some regard, it can be a bit of a humbling process of self-awareness as well, that you were talking about being 19 and having to focus on your health and wellness in a totally new and different way. That's got to be very life-changing and life altering in some profound ways, I can imagine.
Yeah, I think my therapist would agree with you, Alana.
Is there anything you would like pharmacists to know specifically when treating others with anticoagulant medications?
I think that remembering that you're part of our medical team. In a lot of ways, I think sometimes doctors know best and they prescribe and it gets down to the pharmacist, but that pharmacist really has our lives in our lives in their hands, in our medicine, and they're an incredibly critical, important part of our medical team. I have made mistakes in taking my medicine. I like to share the story where I went on vacation and I was young and stupid and I didn't have enough pills and I didn't talk to my pharmacist quick enough to make sure I had enough to go on vacation, and I did something stupid and eventually didn't take 2 days worth of my medicine and ended up right back in the hospital with a massive PE, which again, a lot of people die from. And so our pharmacists are in so many ways the most critical piece of our medical team. So the last mile of making sure that we stay safe and alive.
Yeah, absolutely. Thank you so much for taking the time to speak with me today. Now let's hear from some of our other MJH Life Sciences brands on their latest headlines.